Hello, welcome to the Mossy Dental Clinic. How can I help you? You have a dental cleaning today with Dr. Mossy? Perfect. What's your last name? I've got you right here. You're right on time. I'll get you checked in, and then you can head back to Dr. Mossy's office. You're feeling nervous. I totally understand. Before I started coming to Dr. Mossy, I was also nervous for every single cleaning, everything. I dreaded getting cavities. It was awful. But Dr. Mossy is amazing. She is so friendly and relaxing. She really makes an effort to make you feel comfortable and heard. I will never go to anybody else again. Like, if I was so scared of going to the dentist and now I can work at one, you have nothing to worry about anymore. You'll be so happy. Okay, I've got you all checked in and you can head on back and sit in the chair, okay? Okay. Hi, I'm Dr. Mossy. I'm a receptionist. Got you all checked in for your cleaning today? Excellent. Now, she told me that you were pretty nervous, which is totally okay and nothing to be ashamed of, and I'm hoping to help you with that. What's your biggest concern? Yeah, it is a lot of sounds and smells. I totally get it. I get nervous to go to the dentist myself, and I'm a dentist, so I understand, and I'm going to be here with you the whole way through and help you, okay? We're just going to try to keep it relaxed, nice and easy. When I'm doing procedures in your mouth, if you want me to stop, all you have to do is raise one finger and I will stop and we'll see what you need and move on, okay? Now, would you like some music during our appointment today? Okay, whatever you want. I also have some things here for you to fidget with if you like. Now, if you don't want any of these, then that's fine, but here we go. The first thing I have for you is this little friend. You can name him whatever you want, and he's very soft, and he wants to help you feel good. I also have this worry stone. This is made of labradorite. I call it my dragon scale because it shines beautifully in the light. I also have a stress ball for you that you can just squeeze if you feel uncomfortable. And I have a couple of little 3D fidgets. This one rotates in all different directions, and you can kind of spin them whichever way you'd like. And lastly, I have this little slug. Oh, big slug. He is also very sweet and just wants to help you feel comfortable and relaxed. Now, which of those would you like, if any? Okay, perfect. Here you go. There you go. You can hold on to that the whole time, okay? I have just washed my hands as well, so I'm going to go ahead and put on my gloves. things are always tricky. Okay. Are you feeling okay so far? Okay. Just remember, we can always pause when you want to, okay? Go ahead and lay back for me. I'm going to lean the chair back. Okay. Are you comfortable? Good deal. Go ahead and put my mask on. Okay. Can you still hear me okay? Excellent. Now, before I begin getting into your mouth, I like to have something over my nose when I go to the dentist because I always feel like I am breathing in all of the things that are getting drilled or brushed onto my teeth or when the water kind of sprays, and it just helps me a lot to have something over my nose. So I have a washcloth here and some essential oils, and I can put the washcloth just over your nose so that you don't feel like you're breathing all of this in. Would you like me to do that for you? Okay, excellent. So I just have a regular washcloth here, and I'm just going to fold it so it would fit just over your nose. It's not going to go over your mouth, obviously, because I'm going to be getting in there, and I'm not going to put it over your eyes. Now, if you would like it to be over your eyes, please feel free to do so. I know that this light can be kind of bright, and the light that I'll shine into your mouth may be bright as well. So feel free, if at any point you would like to put it over your eyes, to do so. I'm just going to get some essential oils here. And this is going to be a very relaxing smell. And just drop it onto the washcloth. So that you can have a gentle, relaxing smell while I'm doing everything today. Okay? So I'm just going to go ahead and place this over your nose. Perfect. Is that comfortable? Okay. Now, I'm going to take some x-rays of your mouth before we continue on with the cleaning. So, if you would go ahead and open wide for me, I just want to get a little look first before we do the x-rays, okay? Say, good job. Just looking at all your teeth, looking at any shadows. Looking for any shadows. Anything like that. Have you had any discomfort in your teeth lately? Okay. How's your sugar intake? Yeah, it's difficult. As long as you're trying to keep down your sugar and brushing every morning and night and flossing. I know that I struggle with that one too, but we have to floss. As long as you're doing that every day, then a little bit of sugar every now and then shouldn't be a big deal. Okay, now I'm going to go ahead and take some x-rays of your teeth. So if you wouldn't mind, I've got my x-ray here with some protective coating on it. First we're going to do the left side of your mouth, and then we'll do the right side. We'll do upper and lower on both, okay? So if you would please go ahead and bite down on this. Okay, and Good deal. Okay, you can go ahead and open. Alright, we've got the upper and lower on that side. Now let's go to the next side. Go ahead and bite down on this, please. Okay, move it a little bit. Okay, go ahead and open. Good job. Looks like we got some clear images on that one. Let me just take a look here. Okay, it looks like you don't have any active cavities right now. I do see a little shadow developing in the back of your left side of one of your molars. So please be careful with that area. Make sure you're brushing and flossing it, and we won't have to fill it next time. But it looks like it is developing, so we just want to be careful and watch that so that it doesn't end up being a full cavity that we need to fill next time. Okay? Alright, now we'll proceed on to the cleaning portion. I've got some tools here, and I would like to have you open your mouth wide for me. First, I'm going to just poke around in there a little bit and take a look. Nothing should hurt. If anything hurts, please hold up one finger or say, ah, and I will stop immediately, okay? Okay, so let me just got my little mirror here and my tool. So please open wide for me, and if you get nervous, you can just play with that fidget that I gave you, okay? Okay, say ah. Just testing each tooth here and looking at the inner corners of each tooth. Feel free to close your eyes if that's easier for you. Okay, all done with the bottom side. Now can you tilt your head back a little bit so that I can see the top row of your teeth? Okay, open wide. Excellent. Those are looking good. Did you have any discomfort at all during that? Good. And if you ever need to pause, just let me know. I want this to be as relaxing of an experience as possible for you. I understand how stressful the dentist can be for some people, including myself. That's nothing to be ashamed of. Whatever you need, I want to do for you. Okay? Perfect. Now, I've got this will suck the water out of your mouth, and this will spray it in. So we're going to use this to pre-floss, and then I'll finish it up with a little floss pick, okay? And then we will brush. Sound good? Okay, I'm going to start with the top row of your teeth on the inside, and then I'm going to do the outside of your top row, and then we'll take a little break, and then I'll do the inside of your bottom row teeth, and then I'll do the outside of the bottom row of your teeth. Okay. hold up one finger if you need me to take a break, okay? Okay, inside done. Okay, outside of your top row of teeth is done. Go ahead and close your mouth around this for me. Perfect. Good job. Are you ready for the bottom row? You want to take a little break? Okay, no problem. Take a couple swallows. How are you liking the fidget? I like those as well. I have one at home. I hope that it helps you, and I'm glad that you're enjoying it. You ready? Okay. I'm going to start on the bottom row. And inside. And make sure that I get all the nooks and crannies clean, so that when we brush, it will be perfect. Done with the inside of the bottom row. Now let me do the outside of the bottom row. Open a little wider for me. Good job. Excellent, you did it. Close around this for me. Good job. Okay. We're all done with those. Now, do you use these at home? You use regular floss? I like to use these with my patients because I think it just gets easier without putting both of my hands into your mouth. So I'm just going to go ahead and use one of these if you don't mind. You can take the others home with you. I'll give you a couple of packs. Okay, please open wide for me. I'm going to start on the bottom row of your teeth, okay? Good job. Now the top row. Excellent work. When I'm at the dentist, every so often, I tend to salivate a lot at the dentist when I'm holding my mouth open. So if you would ever like the sucker straw, just hold up 2 fingers, okay? Okay, go ahead. Go ahead and close on this. Good job. Okay, are you ready to brush? Let's do it. I have this special sensitive toothpaste for you. I'll send you home with some of that. And I've got a toothbrush here. Just a standard one. Okay. Got toothpaste on our toothbrush. So go ahead and open wide for me. I'm going to start with the top row, inside. Good job. Top row outside. Excellent. Bottom row outside. And bottom row inside. Excellent. Let me go ahead and rinse. Open wide. And go ahead and switch that around. Ready? Go ahead and close on that. Good job. You're feeling fresh. All clean. How's your anxiety? How are you feeling? You seem pretty calm so far. Good. I'm so happy that I can help. Now I just want to take another look with my light in my mirror. Make sure I didn't miss anything, okay? Okay. Go ahead and open wide. And tilt your head back for me. You're doing amazing. I'm so proud of you. Good work. Okay. Your teeth are looking fantastic. Now, I want to make sure that you keep an eye on that dark spot back there, but as long as you take care of it, then we shouldn't have to fill it next time. But if we do have to fill it, then I will make sure that it's as painless as possible. The only pain you will feel is the little shot, and I will have my assistant drum on your shoulder. While we do it, I'll have all the same fidgets here, and we can listen to music if you like. We can do all the same things. Will I see you again in 6 months for your next cleaning? Excellent. I'm so happy that we had a good experience today. Do you have any questions for me? Perfect. Okay. Okay. Well, I hope you have a wonderful day, and it was my pleasure to help you today. My hygienist will get you finished up, and my secretary will get you checked out, and I will see you again in 6 months. Okay? Thank you so much. Have a good day. Sleep well and stay mossy.